Welcome to this episode of the Body Mind Soul series. Today I'll be discussing the complex, controversial, and profoundly human subject of recreational drugs and their relationship to emotional and existential escapism. Before we begin, it's important to make a fundamental clarification. Critically discussing recreational substance use doesn't mean denying the medical utility that some substances may have in specific clinical contexts, under professional supervision and within rigorous research or treatment protocols. These are two distinct debates. One thing is the controlled medical use of a substance. Quite another is using substances to systematically escape discomfort, emptiness, suffering, or even life itself. And it's this second reality that we'll analyze today. From the Pharaoh model, the central question isn't, what drug is the person using, but rather, what are they trying to alleviate, silence, or avoid through it? Because behind many addictions lies a legitimate search to relieve pain, reduce anguish, belong, rest, or feel something different. The problem arises when temporary relief replaces deep work on the root causes of suffering. Psychological level, Jung. From Carl Gustav Jung's perspective, many addictive behaviors can be understood as failed attempts to resolve a spiritual or psychological crisis. Jung observed that numerous patients sought, through substances or compulsions, experiences of fulfillment, transcendence, or meaning that they could not find in their daily lives. The substance may offer a fleeting experience of relief, expansion, or disconnection. But that which has not been psychologically integrated returns again and again. The shadow does not disappear simply because it is anesthetized. Level of consciousness, Wilber. From Ken Wilber's holistic perspective, it is important to differentiate between states of consciousness and levels of consciousness. A substance can temporarily modify a mental state, but an altered state does not automatically equate to psychological development, emotional maturity, or spiritual growth. Confusing intense experiences with profound transformation is one of the great contemporary risks. True evolution requires integration, responsibility, and deep inner work. Biological level of meaning, Hamer. From the biological perspective developed by Reich-Geerd Hamer, many addictions can arise in contexts of unresolved emotional conflicts. Feelings of loneliness, abandonment, devaluation, loss, lack of belonging, and fear can generate states of suffering that the person attempts to compensate for with substances. The substance does not create the void. The substance usually appears afterward. Traditional Chinese medicine. From the perspective of traditional Chinese medicine, the repeated use of substances can profoundly alter the Xin, spirit, Jing, vital essence, Qi, vital energy, the balance of the heart, and the stability of the liver. Initially, relief or expansion may be perceived. But when regulation becomes increasingly dependent on an external substance, the vital energy loses autonomy. The person gradually ceases to rely on their own internal resources. From the perspective of Taoist medicine, the constant search for external relief reflects a loss of harmony with one's own nature. Drugs can temporarily alter the internal state, but they do not restore deep balance. When well-being depends on a substance, the natural capacity for self-regulation is weakened. The therapeutic path consists of regaining one's center, strengthening the Jing, stabilizing the Xin, and learning to inhabit reality consciously. For Taoism, true freedom is not escaping human experience, but rather traversing it without losing oneself. Philosophical Taoism. Taoism offers a particularly profound reflection. Constant escapism is a form of distancing oneself from reality. The Tao does not propose numbing existence. It proposes learning to inhabit it. Human suffering cannot always be avoided, but it can be understood, traversed, and transformed. From this perspective, freedom does not consist of escaping experience. It consists of being able to remain conscious within it. The crisis of our time. We live in a culture that offers multiple forms of escapism: substances, screens, hyperconsumption, hyperproductivity, constant entertainment. Often the question is no longer, what does a person consume, but what aspects of their life cannot they sustain without consuming something? Pharaoh therapy. The therapeutic goal is not simply to withdraw a substance. It is to strengthen the person internally, to explore the underlying suffering. What pain are they trying to alleviate? What legitimate need lies behind the behavior? To recover internal resources, emotional regulation, body connection, healthy relationships, life purpose. Working on psychological integration, what is avoided through substance use needs to be heard and processed. Strengthening awareness, true freedom is not about not feeling. It's about being able to sustain experience without being destroyed. Reconnecting with meaning, many addictions thrive where meaning has weakened. Regaining existential direction is a fundamental part of recovery. Lighthouse learning, behind many addictive behaviors, there is no search for pleasure. There is a desperate search for relief. But relief that disconnects never replaces the work that transforms. Lighthouse phrase, escape soothes for a moment, awareness transforms for a lifetime. Work on your suffering with intelligence and awareness, and seek help when you need it. No drug can do the work of transforming your life for you. Drugs can alter an experience, but they cannot build an identity. Subscribe to the channel, like, comment if you wish, and share this video to raise collective awareness. Learn science with awareness because in health, knowledge is not neutral. It is vital. Train online with the E.L. Farrow School of Higher Studies in Integrative Health. Inquire about training in Spanish, French, or English.